As a medical doctor, I'm frequently asked about the medical effects of hemp products. Cannabidiol, or CBD, is the primary naturally occurring medical compound in hemp. Like THC, CBD is a cannabinoid, but its effects are markedly different from THC. CBD is completely non-psychoactive and actually blocks some of the intoxicating effects of THC. There is mounting evidence that hemp-derived extracts containing CBD provide anti-inflammatory and analgesic benefits.
Cannabidiol, or CBD for short, is the second most prominent compound found in the cannabis plant.
A lot of the medical benefits of cannabis that are attributed to THC or other cannabinoids are actually due to the CBD content of the cannabis.
It has very strong anti-inflammatory properties. And not only does it help suppress inflammation, but there was a study that showed that it also helps the body to not make the chemical that causes inflammation. So it actually has somewhat of a preventive role. CBD has also been shown to protect against brain injury when patients or lab animals have had a brain injury. CBD appears to protect the brain.
Hello, my name is Dr. David Allen. I'm a retired cardiac surgeon and a member of the International Cannabinoid Research Society, ICRS. That means I'm a cannabinoid research scientist. And I'm here to tell you about the discovery of the endocannabinoid system, the ECS, and the significance and how it will change medicine. The discovery of the endocannabinoid system is the single most important medical scientific discovery ever, and will save more lives than the discovery and application of sterile surgical technique. And I'm a heart surgeon saying that.
But recent research has been looking at cannabis and the different cannabinoids. There's over 80 plus cannabinoids discovered in the cannabis plant. The second most dominant one besides THC is cannabidiol, or CBD. Okay. And the research now is over 1,200 peer-reviewed journals on CBD. It's probably the most exciting and researched ingredient or substance right now around the world. Mm-hmm. It doesn't have the psychoactive or high that is associated with THC, but it has a tremendous amount of other benefits. There's anti-anxiety, which is really important. It's the anti-THC of sorts. It calms you down. It helps you manage stress better, which is how I look at it. It's much more as a preventative or daily use substance than just treating disease states. And there's immune support. It's a huge antioxidant. There's just a tremendous. It's easier sometimes to talk about what it doesn't do than what it does.
The medicinal uses of hemp are just numerous. The hemp helps, well, we can talk about the cancer effects of hemp, but it helps with inflammation. It's very anti-inflammatory. It helps with seizures. It's very effective with PTSD for the vets that are coming back that have post-traumatic traumatic stress disorder. Mm-hmm. Very effective at treating that. It's an anti-inflammatory. It's not just a superfood. It's not just great for industrial uses, as we've mentioned, but it's a really good medicine.
My name is Alan Zupkin. I'm board certified in addiction medicine, and I have a practice here in Central Florida. If I ask my patient population what are their three most common complaints, I hear anxiety, panic attacks, sleep disorders, chronic pain. When I found out about CBD, I was really encouraged. Another thing as a physician that I really found comforting was that there was a tremendous amount of research that was done on CBD long before the product was available. There is sound science that backs this product up. When any physician hears that there are receptors for CBD in the brain, that it works on the limbic system, which is the brain's emotional system, they can really understand how this can be beneficial to their patients. One of the reasons that people are trying to legalize medical marijuana in this country is for its CBD content. This product, which is sold as a supplement, is legal in all 50 states.
Physicians are increasingly recommending CBD as a complementary and alternative therapy for relief from symptoms such as pain, inflammation, stress, and anxiety. In particular, CBD appears to provide significant benefit with respect to chronic pain.
Canna is